ways in which you are striving to promote health and equity through innovative solutions. We will spend the next half an hour with our presenters for a live Q&A. You can submit your questions for the group in the chat box.
Intro video.
Hello, we're live again. Sorry, we had a little hiccup with the audio. Hopefully you can all hear me now. So before we get to some audience Q&A, I'm going to start with some questions that we already have pre-prepared. So something that I noticed throughout each of your presentations is you really talked about the impact of multi-component interventions or strategies to have the best outcomes and to be most acceptable for the people who are using those interventions. So one thing that I have a question about is, can you please give me at least one example of who is required to be a collaborator or partner on those projects in order to have those best outcomes? And why don't we start with you, Ms. Yoder?
Hi, thank you so much, Lindy. Really from a retail perspective, when it comes to food as medicine programs, we're doing additional research because we really see the value in the collaboration and partnerships between the food retailers, the consumers, and as well as the registered dietitians leading these programs. And so right now we're doing additional research to really gather the perception of the consumer and the retailer and get that executive and the consumer sponsorship of these programs to really start to get buy-in, but also really how can we get the most effective health outcomes as well as the business outcomes from the retailer side. So it's a multi-pronged collaboration, but equally essential in each of those different parts.
Great, thank you. Ms. Auvinen, I know you work with a lot of different partners with your project. So would you be able to talk about what are some of those key partners you're working with and maybe what they're bringing to the table that is helping it be successful?
Yeah, definitely. I'm happy to share about a big collaboration we've been working with on our fruit and vegetable incentives program for the last 6 years now, which sounds like a long time in my world. And it's what we call our Fruit and Vegetable Incentives Advisory Network. And so this was kind of brought together by the Department of Health back in 2015. And it was really an advisory network made up of other state agencies, advocacy organizations, and then what we call kind of like implementing partners, folks on the ground, like in farmers markets or in the retail setting. And really the goal of that advisory network was to help guide us strategically in terms of finding sustainable funding for this program or these programs, how we should do outreach and communication across multiple state agencies and make sure that we're all in line with the same messaging. And also kind of thinking through some of the important evaluation components that we would need as a program for program improvement, but then also to make the case for some of those sustained funding asks. So that included Department of Health, obviously, our State Department of Ag, our SNAP administrative agency, and like I said, a bunch of advocacy organizations and then farmers markets and grocery stores. We also had input from the University of Washington, from the Research Lens, which was great. So it's really, that was one great partnership. And I think one of the things we realized in the last few years was like, we did not have participant level or we didn't have any feedback or input from folks that are actually using the program. So last year we decided to develop a community advisory network, which is kind of in parallel to our advisory network. And it's folks that are actually using these programs on the ground. And we're working with a really a great NGO in our state that is highly focused on social and racial justice. And they're helping kind of bring together that community advisory network monthly to guide our work at the department, which otherwise probably wouldn't be done if it was just the department having to do it on our own. So those are some of our examples.
Great, yeah, and I know it was mentioned multiple times that hearing from the people who are actually using the program is so important. So that last component seems to be a big piece of your work and where a lot of success will likely come from and is coming from. Dr. Harnack, do you have any great collaborations that you've had in the past that have been really promoted or helped with the research that you've done in this area?
Right, to be able to do the kind of research to properly evaluate possible changes to SNAP and other programs and policies, the partnership with the government agency responsible for, administering that program is crucial for our evaluation of SNAP. The Minnesota Department of Health and Human Services group, Tiki Brown and her group, who run the SNAP at the state level, they were crucial to helping us best design this study and carry it out. So those partnerships are really crucial.
And is there best way to kind of, I want to say, manage those relationships with those folks? Because I know that that's a very different relationship than it might be with others.
A key part, is being really good at getting the results and findings from studies back to the community groups that have partnered with us, because we're doing it to support their work. And so we need to make sure that we don't just publish a paper in the scientific literature, that we get that information back and circling so that we can figure out the next thing that needs to be done as well. So I'd say that's a key to partnership, is making sure that the knowledge gained is given back to the community and the study participants.
Yeah, definitely. And Dr. Shah, you have this really diverse background in the work you've done, so you can bring your perspective from a variety of different areas, but what have been some of the best partnerships or collaborations that you've had, within your work that you do currently or even in your past work?
Yeah, I think most people said this, but making sure the voice of the community is part of the conversation and is so critical. I think program and policy development really needs that community engagement. I would also say working with trusted messengers, so community leaders, local leaders, don't forget local media, they're effective way of making sure the message is out there. And then, I think some more innovative ways to get buy-in from the general public is working with content creators. There's so much content that people absorb on a day-to-day basis. So whether it's working with the entertainment industry, whether it's working with, social media and content creators, even fandoms could be an effective way to get the word out. So I would say, making sure your outreach strategy is broader is extremely helpful.
Yeah, and unique partnerships, it sounds like, too. You want to always think about marketing or working with maybe marketing or things like that. So yeah, thank you for sharing. Something that I also felt kind of continue to come up, and this also stems from the keynote speaker and the discussion earlier, is really having accessible interventions. So I know this is something you talked about, Ms. Yoder, and then Dr. Harnack. I know your work goes into this as well, but what are some ways we can be more accessible using online interventions, specifically to different populations of people? So Dr. Harnack, if you don't mind, why don't we start with you?
Right, well, I think with online grocery shopping is one area with now that SNAP can be used for online grocery shopping that has a lot of potential to help people who have access issues and maybe disability issues with being able to physically get to a grocery store near them. And so really figuring out, should that be sustained past the pandemic, and how can it best support SNAP participants? And with FNEP and SNAP-Ed, the education components, it's always been a challenge for people to get to the education classes. And really it's really a time to think about, can we deliver this education online?
Yeah, great. And Ms. Yoder, we can go over to you.
Yes, and right along the lines with what Lisa was saying, with the availability and the option to utilize SNAP benefits online now, it's an increasingly more accessible to really start to deliver these benefits to so many individuals in need, particularly this past year. With that said, we also need to make sure from an e-commerce standpoint that we are also accommodating the dietary guidelines when we are interventing and providing nutrition education to these individuals. And so how can we begin to really start to get virtual and digital solutions that are available and accessible to individuals that really coincide with the availability of the SNAP benefits? And then also with the e-commerce and online grocery, it's also crucially available that we have affordable delivery options to rural communities that may or may not have grocery stores nearby and hefty delivery fees. And so how can programs and grocers and retailers and other community organizations really play a role in not just providing healthy, accessible food through online and e-commerce, but also how can we get those groceries delivered to these individuals in an affordable manner as well?
Definitely, all very important key things that you went into there. Dr. Shah, can you expand on ways that you think, whether it be online or other ways that we can make interventions more accessible for all people?
Yeah, Lisa and Allison mentioned a few. I think language accessibility is so important, not only for people with a limited English ability, for people who are who may not be able to, who need other resources as well. So I think language accessibility is so important. Also, making sure the realtors that we're using are diverse, ethnic grocery stores, including them in accessibility would be so important as also.
Yeah, reaching different communities and all populations, obviously accessibility. Ms. Auvinen, do you have what is your program doing in terms of really reaching out in that accessibility lens?
Yeah, I guess maybe I'll kind of think hopeful in the future rather than kind of what we've done. And I'll pivot from our produce prescription program to, we have a SNAP incentive programs in 100 farmers markets and then Safeway grocery stores, and we're expanding to an additional 52 grocery stores over the next few years. And I think one of the things that comes up over and over is like we're developing essentially with healthy SNAP incentives a parallel program to the SNAP program. It's not integrated like it was onto a card in the healthy incentive pilot that Lisa was mentioning, and reinventing this wheel over and over and state by state doesn't need to happen. And so I think this is one of the things where looking at the federal and then state, potentially local level, like what are those systems in place and the like tried and true systems that we can really work to integrate some of these interventions into is needed. And I don't think with like SNAP incentives, I don't think we're there yet, but I think we could get there. And like I said, that HIP pilot is really one of the things we should look towards.
Yeah, definitely kind of working a little bit smarter rather than harder and having everyone do something and instead maybe coming together and working all on it. So another question I have for you, you all presented really, really logical interventions and ideas to some of the more complex issues we're talking about today in our society. So what will it take to get buy-in from the general public in these specific, topics we're talking about? And what will it take to get buy-in from both the private and public sectors? And why don't we, Dr. Shah, why don't we start with you?
Yeah, I mentioned a few about like working with local media and local leaders to get the word out. I think that is so critical to explain the benefits not only to the people who use them, but to the general public as well. So let me just start there.
Yeah, great. Dr. Harnack?
So with changes to SNAP, I think we still need to know a lot more and understand better the needs of SNAP participants. And so to get that sort of buy-in is to make sure that what we're designing is actually what is wanted and needed. And so I just going to encourage that we seek more input from SNAP participants as we consider changes to this program that touches so many Americans. Any change we make, we need to make sure we're on the right path.
Ms. Auvinen, why don't we go to you next?
Yeah, I think Allison mentioned kind of return on investment is critical, especially kind of showing the return on investment for example, like produce prescription programs or SNAP incentives to the retailers especially is really important. I mean, one thing that we come up against regularly in conversation is, well, why would I make a change to how I run my business or a change to my point of sale system to accommodate this program if the funding is going to go away in a year or 2 years? I think we need to kind of show the cost benefit of that. And I think the work there still needs to be done in many cases. There have been pockets of that though.
Mm-hmm. And definitely when it gets into those private and public partnerships that you work a lot in, whether it be through prescription produce or SNAP incentives, that takes a lot of work within itself and a lot of buy-in and return on investment is always a good way to show that. Ms. Yoder, do you have anything to add to that? I know you have already done a lot of, private partnerships.
Yeah, it really depends on what is that target audience that you're working with. So to really get the buy-in from the general public and consumers in general, it comes down to really understanding what are their perspectives as well as what are their barriers, and then developing those interventions and incentives that really tackle what is at the true heart of what could prevent them from being successful in the program, or what really gets them excited to want to participate in the program. And exactly where Alyssa was going from a retailer perspective and buy-in, it comes down to the executive sponsorship and really seeing what is the heart of that return on investment. But also from another sense, and Lisa, you were touching on it earlier, when you're working with these private organizations and businesses, there's really a lot of proprietary data that comes out of the research and the interventions that you're doing. And so a goal would be, how can we make, keep that proprietary data as private as we can, but how can we get more published research on just the successful outcomes that come out of these private partnerships, and really start to show the value that a lot of these interventions are coming from, but in a way, a hindrance and a barrier to publishing a lot of these successful outcomes and studies is that proprietary nature. So finding a way to really meet in the middle and get some more just data out there on how successful and where the avenues and the opportunities can be for integrating these programs into different audiences and communications and communities.
Yeah, great. And I think it's something Dr. Ellinger said earlier is we all want to be a part of it and help. But there is a space where we're coming from, and we want to see what we want done, but we want to provide and support everything everyone's doing. So that was a really, really great comment. Thank you. Okay, I do have an audience question. So what can be done to establish grocery stores or other viable retail options in the zip codes where they are needed? And Dr. Harnack, why don't we start with you? I know you do a lot of work with rural communities and looking into rural food insecurity as well.
Yeah, I'm not real knowledgeable on the mechanisms to get better availability. I see the online grocery shopping as being a way to really address that gap in the short term. It's not maybe it's a long-term solution, but it's one solution.
Yeah, definitely. One avenue towards that. Ms. Yoder, why don't we go to you? I feel like with the grocery store question, I'm going to pitch it to you.
No, that sounds great. I would first get, what are the grocers that are in your community? Are they, nationwide groceries, or are they more regional or even local? And where we can really start to get into the heart of those rural communities is developing that needs assessment. And really, how can we create a need for there to be access and better access to healthy and affordable food, and then also working alongside with a retailer or a community-based organization on how to possibly get it there. So it might not be a land-based grocery store, but can we have a mobile produce market or vendor, making trips down to these areas that are in more need? Do we have an opportunity for a food clinic that's associated with a medical facility that's in these communities? Is there an opportunity to have delivery for groceries in these communities? So really looking at creative and innovative ways on how we can continue to deliver healthy and affordable food to all areas and all communities that are in need.
Great, thank you. And Dr. Shah, I know this is something you talked about in your presentation, is that disparity in zip codes. So are there any ways, any policies that you could think of specifically that can be done to really help invigorate these zip codes that need, whether it be grocery stores or other services that are not accessible to them, that will be the support that they need to lead a better and healthier life?
Yeah, I mean, long-term infrastructure, community development support is so needed in the zip codes that lack access to, viable grocery options. And so, that obviously takes policy input, and so both at the state and the federal level. So making sure those zip codes that, have food deserts or have the funding they need to bring in the businesses to build a brick and mortar is so important. And then I think online shopping could be extremely helpful, but making sure those resources are accessible to everyone, making sure people know like what are those WIC and SNAP friendly grocery stores will be really helpful, making sure what's available and what's not available in grocery stores. I mean, I think with technology, there's a lot of opportunities to make things more accessible for the people who don't have access right now.
Great, thank you. I have another audience question. How do you think commercial plans can be convinced to cover such interventions as the ones we've discussed, given that they are likely have more turnover than plans like Medicaid or Medicare? And secondary to that, it may be more difficult to anticipate and measure any benefit from reduced healthcare costs over time. So I guess, again, the question is, how can you convince, and maybe Ms. Auvinen, we'll start with you, how can you convince commercial plans to be a part of prescription produce or other initiatives that we're working on?
I wish I had the perfect answer for that. And I will say we're choosing to try to work with MCOs for a reason. I think maybe I'll pivot this to working with MCOs. There still is turnover among kind of year over year. A patient might choose to get connected with a different managed care organization. And so I think one of the ways that the state could kind of play a big role here is in how they decide to contract with managed care organizations or other health insurance plans. It's possible to write produce prescriptions or nutrition interventions into contracts with these companies. They're not doing that in Washington state right now, but they are doing that in other states. And so I think there's probably going to be a lot of lessons to learn over the next few years as kind of those nutrition interventions or housing interventions become more and more prevalent. If that's enough of an answer there. Sorry, I don't have a commercial key.
No, thank you. Does anybody else have, I won't call on anybody, does anybody else have a strong, yep, go ahead, Ms. Yoder.
Yeah, absolutely. So I would say the best thing about this past year is taking advantage of this window of increased reimbursement opportunities that come from digital solutions provided, particularly telenutrition visits with the dietitian. When you're able to collaborate and include those on with additional food as medicine programs for, say, medically tailored meal boxes. We are seeing commercial programs, and really when it comes to the scalability of these programs, particularly with the capability of food retailers and the ability to scale these programs, we are seeing some successful partnerships with commercial reimbursement opportunities when it comes with combined multi-component intervention services. So with that telenutrition component and a medically tailored food box, we're able to track those outcomes and start to see some good benefits. But right now there is a window of increased opportunities for reimbursement, and we don't know when that window closes. So I encourage everyone in the meeting today to really start to look and explore on how to take advantage of some of those billing codes and really getting an opportunity to really maximize this window of opportunity right now.
Great, thank you. Dr. Harnack or Dr. Shah? No? Okay. So another question that I have is COVID-based. So our country has faced significant challenges over the last year as a result of the COVID-19 pandemic. And along with that, we're also under a new presidential administration. So what are some policies that the new administration should prioritize in response to COVID-19 and the larger unrest in our society today? And Dr. Shah, why don't we start with you?
Yeah, thanks for the question. I think COVID epidemic, as well as the conversations about structural racism, have really shed light of the broken systems in this country. And and in terms of what policies could be helpful, both at the state and local level, I mean, healthcare access is critical. Making sure people have access to the healthcare they need. Improving food insecurity. We talked about a lot of the policies today, SNAP, WIC, the pandemic EBT program, school lunches, making sure they're fully funded and people have access to them, the people who need them have access to these programs. Paid leave, paid sick leave are so important as well. Making sure people have the opportunity to stay at home if they're sick or they need to take care of a loved one. I think we have to make it easier for people to access these benefits, and make sure these benefits and programs are seen with dignity. So, like, if people utilizing them, we want to make sure that the program treats them with dignity, and then and that's so critical moving forward as well.
Great, thank you so much. Dr. Harnack?
Right, with my researcher hat on, the pandemic led to all these changes to our federal food and nutrition programs, which presents us with an opportunity to see which ones maybe wound up being really great and we should continue them forward. An example is a pandemic home delivered meals for summer school meals to rural children was implemented by Baylor University with USDA funding to millions of children over the summer. Through the mail came 2 weeks worth of school lunches for the summer school meal program. And maybe that's a good idea every summer. There's research going on to evaluate it, and we're actually a part of that evaluation, but if we can turn around the evaluation data and share that back with policymakers and the public, maybe some of these things should be continued. And maybe some really didn't work and didn't fly and shouldn't be continued, but that intrigues me. And I think with the racial justice, there's been a real recognition that we in nutrition research and public health need to take a hard look and make sure that we are being real appropriate in our research and in making sure that the community is engaged in providing the ideas, and we're not coming up with our ideas and imposing them, that just making sure that, again, that we're going about our work in the right way.
Yeah, great. I think you make a good point that we've heard before, but COVID-19 has obviously been horrific for our society, but it has kind of uncovered the issue of food insecurity and ways that we can address it that have in a unique way presented themselves. So it's good to hear your idea to evaluate these and then continue them into the future. Ms. Auvinen, what are some ways or policies you would like to see addressed?
Yeah, I definitely think boosting up WIC and SNAP and making sure that SNAP benefits are adequate to feed a family. I know Lisa mentioned that obviously it's a supplemental nutrition assistance program. It's not supposed to cover the entire cost of food over the month, but that's what it happens for families, So I think adequately funding those programs is important. And then I think one thing that I didn't have prepared, but I think is important to bring up is reversing the public charge rule that the previous administration enacted last year. And I know that that's on the Biden administration's docket to do, but I think not just reversing that rule, but also doing significant messaging for the communities that have been impacted by that rule, because there's a lot of fear. Even when that rule is reversed, there will continue to be fear in communities that have been affected by it.
Yeah, no, thank you for sharing. And I think a lot of people don't know that when you're going back to the actual amount of money that people on SNAP get, that value or the market basket that their actual daily or monthly cost is based off hasn't been updated in decades, and so that really needs to be updated to reflect the current cost of food. Ms. Yoder?
I echo what the other speakers really said. With COVID, it has just increased the awareness of the prevalence of food and nutrition security in America. And we have an opportunity and a political opportunity with the 117th Congress to really address and take a look at how the administration is addressing not just increasing benefit and access to the food and nutrition benefits that are available, but also there could be an opportunity to really better align with the dietary guidelines for Americans and these benefits. And the research that Lisa's doing is really showing the positive reactions to individuals that are on these benefits and the ability to provide access to those nutritious foods. And so we have an opportunity with the administration, and we're closely watching, where they're taking the appropriations and the discretionary fundings to really focus on WIC and the dietary guidelines and other opportunities that they're prepping for.
Great, thank you all. I'm I'm going to end with just kind of a question we tend to ask for a wrap up. But what is the one takeaway you would like to share with our attendees today? And we'll start again with you, Ms. Yoder.
We are all on the call today because we have a common theme that we all want, we're all interested in food as medicine. We're all coming at it from different angles and perspectives. And I would encourage everyone on the call to really, how can you network with other individuals who have this same common theme? And how can we truly make an impact by working together from our different angles and perspectives to really move the needle forward and bringing more light and attention to food as medicine and consumer health in general.
Thank you. Ms. Auvinen, we'll go to you next.
I would say the same thing, and I think this came up this morning too. Seek out partnerships that you don't think would normally fit within your box. That seems to be where a lot of success and innovation comes, and I think where we need to be headed.
Thank you. Dr. Harnack?
I would say, putting on that health equity lens, that realizing that all Americans want to eat healthier, and working towards figuring out how to support people in that effort. And I think what's been said about working across areas like food retailers, partnering with food nutrition programs, and cross-cutting work is key to that work. The multi-component approach, that socio-ecological framework, we've got to hit all those different levels to really help support people in their efforts to eat healthier.
Yes, thank you. And Dr. Shah, we'll end with you.
Yeah, I just want to plus one to what everyone else has already said, but also thinking about how do we engage with community members throughout the process and really talking to them, hearing what their needs are, and incorporating that their needs and their perspectives in programming and in policy making is so critical.
Yeah, and I feel like that's something that's been repeated amongst this group and the group this morning, but really engaging the people who actually are affected by the programming, and voices need to be heard.